Hey team, today we're going to talk about Osgood Schlatters, and that's just a really long name from the guy that discovered the condition. You would have seen in our newsletter on youth injuries. Osgood Schlatters is something we see in the clinic and in our college clinics quite a lot, and it affects a reasonable number of young people participating in sport. So we've got Andy here.
Yeah.
What can we tell our team about Osgood Schlatters?
Yeah, so commonly Osgood Schlatters is referring to sort of a tendon injury where it attaches to the bone at the bottom of the knee, top of the shin bone there, and essentially it's when the growth plate starts growing and that tendon doesn't have time to catch up and starts pulling a little bit on the front of that bone and gets really sore.
Yeah, so we're talking about the tibia here, the shin bone. That's where you see the bump appearing. And it's nothing dangerous. It's more of a what we call an overload or overuse injury.
Yeah.
And we see this in kids like basketball, volleyball, lots of jumping, explosive type sports, netball as well. And we usually find there's a history of just training too much and really just trying to push through it. And it can be quite worrying for the children and for their parents.
Yeah, and absolutely. And in terms of managing this, really our first protocol is stripping back that load to give it a bit of time to recover and settle down. Often we can start with not having to fully alleviate all training, but just starting with half and going from there, whether it needs to be pulled back a bit more, and then reintroducing training from there in order to get on top of it.
Exactly, and so what we must remember is the bone is quite immature at this stage. It's still developing, and we're putting a lot of stress through it. And so your thigh muscle, your quads muscle is contracting hard when you jump and when you hop and when you explode, and it's pulling on bone that's actually still developing as well. We see it in young girls and young guys between sort of 8 to 13 years of age.
Yeah.
So what sort of things can we do to help these kids out?
Yeah, so especially with jumping sports, how are you jumping? Are you landing and putting lots of force through that leg, or are you landing nice and softly, absorbing that force off your quads, hamstrings, thigh muscles, working really well there? And the other sort of things we can do is just making sure those muscles are strong to be able to meet the demands of the load the sport you're doing is putting on that joint.
Yeah, exactly right, and lots of education. It's good to involve the parents as well and the coaches. I think it's good to involve them so we're not overtraining our young ones and leading to these sort of things. So that's just an example of one of the typical conditions we see. It's not an accident, it's not dangerous, and usually it resolves as you stop growing. So we must also be aware of growth spurts, and manage those accordingly. So if you're a parent, you're a coach, and you've got something like this happening, don't hesitate to come and see us, and we can have a look at it and at least start some education and advice for you. So I hope that's helpful. Until next time, we'll catch you soon.